Why is the Babinski reflex checked during epilepsy diagnosis? Imagine your doctor gently stroking the sole of your foot to see how your nervous system responds. This simple test, called the Babinski Reflex, is actually a powerful tool in understanding how your brain and spinal cord are working. During an epilepsy evaluation, doctors include this test as part of a thorough neurological exam. They do this to check the health of the central nervous system, especially a major pathway called the corticospinal tract. This pathway runs from the brain down through the spinal cord and controls voluntary movement. If the Babinski sign appears in someone over 2 years old, it suggests there might be damage or dysfunction in this pathway. That could be due to various neurological issues like stroke, tumors, infections, or diseases such as multiple sclerosis. These conditions can sometimes cause seizures or mimic them, so finding out if there is damage helps doctors understand the bigger picture. The test involves firmly stroking the sole of the foot with a blunt object. Normally, in adults and children older than 2, this causes the toes to curl downward. But if the big toe extends upward and the other toes fan out, that's called a positive Babinski sign. This response indicates that the upper motor neurons, which send signals from the brain to the spinal cord, might not be functioning properly. It's normal in infants up to about 2 years old because their nervous systems are still developing. Checking this reflex during epilepsy diagnosis is quick, simple, and doesn't require much cooperation from the patient. It's especially useful if the person is confused, unconscious, or recovering from a seizure. The presence of a Babinski sign can point to underlying neurological problems that might be contributing to seizures or other symptoms. It helps neurologists decide what further tests or treatments are needed. In essence, this reflex test provides important clues about the health of your nervous system and helps distinguish epilepsy from other neurological conditions. It's a safe, non-invasive way to gather vital information that guides diagnosis and care. Always remember, if you have concerns about seizures or neurological health, consult a healthcare professional for personalized advice.